Good morning, everyone.
There you go.
Yeah, that's better.
Hi, Lisa. Hi, Wendy.
Hello.
Hi, Wendy.
I actually have a new potential member who's going to be calling in just by phone today. So, Melissa, I will send you her phone number. So, if it comes up, rather than it just being a number, we can actually put her name in. Should that go to you or to Jessica? Who's hosting?
Jessica.
Jessica.
I'll send it to Jessica.
Okay.
Yep.
So I'll send you the phone number so that way when it comes up, it'll be
Sure.
you'll have it.
Yeah, you can just send it to me in chat. No.
Okay. Yeah, I'll do that.
Okay, I guess we're waiting for everybody to get on here.
That was another minute and a half.
Well, you were on top of that, Carol.
Hey, I got the clock right
Come
there.
on.
Hey, I was late last month. I really was very upset with myself. I had planned on being here, and all of a sudden I turned around and it was like, I damn close missed it, and I don't think anybody even knows I was there.
Oh, well, we would have known if you weren't there at all. We would have known that.
Thank you.
We would have been sad.
Thank you. I love that. I appreciate that. We've got to pull up the agenda.
I actually just got a question from.
Oh, whatever. B, I'm sorry. I was going to pull up the agenda on my little tablet.
Yeah, Jessica puts it up for all of us.
Okay. I was hoping that I didn't interrupt anything.
No, it wasn't you.
Okay.
It was Jessica.
Oh, God. What did you do now, Carol?
Jessica's the only one who has control. The rest of us, she's in charge.
And that's fine.
So what do you think? Do you think we have everybody?
Yes, we're a few minutes past, so I think you can go ahead and start, Madam Chair.
All right, let's do that. Well, I'm going to call the meeting to order, the Regional Advisory Council. We want to welcome everybody. I was looking at our attendance last time, and we just had a really great attendance. So I guess sometimes there are some advantages to Zoom, everybody can get here. But anyway, so we have a couple consent items. Are there any changes to the agenda? The agenda is up on our screens. Anything we need to change or add? Hearing none. Are there any changes to the minutes that were sent out to all of us? Any corrections?
Hearing none.
Okay. Hearing none, may I have a motion to approve the agenda and minutes?
I move to approve the two consent items, the agenda and the minutes. Dave Betzler.
Thank you, Dave. Is there a second?
Second, this is Jen.
Thank you, Jen. All in favor, say aye.
Aye.
Those opposed? Abstentions? Okay. The agenda and minutes are approved. Okay, then Jody, we have public comments related to the mobility manager update.
Yes, thank you, Madam Chair. Before we get to that, just want to let folks know that Wendy's computer shut down. She just texted me, and so she'll be joining us either by phone or her computer again. So we'll just be watching for her and get her caught up. Her report is later on in the meeting anyway. So before we get into our mobility update, I did want to clarify a question that came to me via chat. I do want to encourage those who are not board members of the RAC that yes, you are most welcome to be here to join us, to watch and listen the goings on. We are a public organization, and therefore these are public meetings. So we welcome you and thank you for joining us, so you can see what other parts are going on in the world of aging as it relates to the Older Americans Act dollars and the Area Agency on Aging, and how we collaborate across the 3 counties of our region. So thank you to those of you who are colleagues and members of the public. We appreciate you taking time to be with us this morning. The public comment we have this morning is just an update from our mobility coordinator, Laura Cruz. And so I will hand it off to her for her update. Thank you.
Good morning, everyone. Thanks for spending some time with us this morning. I just want to give you guys a quick update on some things that we're working on in terms of mobility coordination. And so we have talked to you all several times over the past year about the transition of federal transit dollars coming from MMT to PPACG. That is 5310, what's called $5310, and that's for specialized transportation. And so for many years, MMT has been the designated recipient of that funding. And so because of, some changes in the environment, we all came together as a consensus between the service providers and MMT and the city that this 5310 funding works well with the different programs that we operate as a AAA. And so a significant amount of AAA dollars goes towards specialized transportation. And so this 5310 money will help complement that. So where we are in that process is last month, it was this month. This month, the board approved for us to move forward in becoming the designated recipient of 5310. And so we are concluding some of the steps this week. One of those steps in particular forward is to send a letter to the governor requesting that status and requesting the funding. And so we are sending off that letter with the signatures of both Andy and Craig at MMT. So it's a joint effort for sure for us to transition this funding. And so after that, we are working to present a program management plan. This is a requirement by FTA for us to have this in place. The program management plan just details how we're going to operate and utilize the funds. And so what we're doing is we're putting together this large plan. We're going to kick it off to the board this next month to view a draft of that plan, and then they will kick it to the rest of the committees, including you guys, to view that for public comments. And so I'll be looking for y'all to take a little bit of time and review that document and make any suggestions that you may have moving forward. So
it might end up being perfect because.
Go ahead, Laura.
Go ahead.
Just a reminder, if you are not presenting or you are not speaking, please make sure that you're muted. And just to clarify, this is a business meeting, so we ask those members that I just thanked for coming, or those folks from the community and public that are joining us today. Please keep in mind, we will have, this is the area for public comment, and so we just ask that you mute yourself. Thank you.
Yeah. So we will be presenting that program management plan, the draft of the program management plan, to the committees starting October 1st. That is our goal. We have to go through a few revision processes with FTA, and then our hope is that we will receive the designated recipient status, as well as be set up to start this next year doing a call for projects that will hopefully in the next few years coincide with the call for projects for AAA. So that is our goal, and that is what we've been working on, and it's just an added supplement to the tune of around $500,000 a year more into the program to help support it. And so that's going to be super helpful. Are there any questions for me about the process and where we are and what we're trying to do?
Laura, could you give us some sense of, are you trying to reach just all people with disabilities, seniors? Who's your target audience here for the program?
So the target audience is seniors and those that are disabled. That is what is covered under 5310. And I want to give you a little perspective. You know, while the AAA covers 3 counties, this funding is only available for El Paso County and a small portion of Teller County. That's within the FTA guidelines for this specific funding. There is another funding stream that's being utilized by our partners in the rural areas, and that is 5311 funding that comes through FTA, as well as AAA funds that we support them with.
Are there other questions for Laura?
Yeah, Laura Day Betzler here. A couple of questions. Is this an initial plan, or is this a adaptation of an existing plan? That's one. And the other one, what's the dollar amount in the 5310 funding that we're talking about?
Yeah, that's a great question. So this is not an adaptation of an existing plan. This is our first time as PPACG, to my knowledge, and talking to staff, that we've ever will be receiving direct funding from FTA. So there's a lot of different layers that I've had to work through over the past couple of months since I've been here. And so understanding the FTA regulations, being able to infuse AAA policies as well as FTA policies into this plan. And it's really the program management plan is kind of technical, making for sure that we check all of our boxes and make for sure we have a structure in place so that we're following all regulations that FTA puts in place. And to your funding question, we're looking at for our urbanized area, and that's what they call, that's sort of the section or geographic area that FTA calls is a UZA or urbanized area. So for the Colorado Springs urbanized area, we have designated around $500,000 a year that will be provided through the 5310 funding.
Thank you.
Yeah, great question.
And Laura, this is B again. Are you talking about direct services, or are you talking, to these populations, or are you talking about some kind of plan to provide services? Which is it?
So this funding is to provide direct services through service providers. So currently, we are working with several providers throughout the 3 counties to do transportation through AAA. There's 4 in particular that have been benefiting benefiting funding through MMP for the past several years, and that's Invita, Silver Key, Fountain Valley, and Community Intersections, I believe is what it's called. I'm learning a little bit more about them, but essentially this funding has helped support the cost of rides. And so that is what we will be working on moving forward, is just that transition of funding from MMT to us to help support the ridership of that program.
And I know most grants have a section called unmet needs. Have you already identified those?
That is a great question, B. You know, that is one of the things that Jody and I have been talking about since I started, and that is we need to be working on how do we identify these unmet needs. And so we're looking towards in the future, working with the community to identify those needs through working with community service providers, members of our committees, and also those individuals that take advantage of those programs, just to identify what are the gaps in our area. So there is kind of a hole in information right now, but I will say that back when we were putting together the AAA plan, the 4-year AAA plan that we have to do, there was a study done in 2018 that identified 2 main issues in our community in particular, and that was affordable housing for seniors as well as transportation. And so we do have some data that addresses some key points and challenges. And so that's a starting point, but we need to figure out geographically what some of the issues are. As you know, populations move, how do we pivot our programs? So those are definite things that we'll be working on with the community to identify and utilize some funding in the future through some of our current resources and also resources that I'm learning a little bit about that we may be able to use to do a study to better understand those gaps. So that's a great question, B. I mean, I think that's a big point that we need to work on moving forward.
Are there any other questions? Okay, well, thank you so much, Laura.
Thank you so much, Laura. Excellent.
Yeah. Thanks.
And Jessica, could I ask you to take down the agenda so that I can see all the participants? Otherwise, I only have about 4 people on my screen. Is that possible?
Sure. Yeah, I can do that.
Thank you. Thanks a lot. Okay, so we're moving on to our provider presentations, and then so we have Mountain Community Senior Services. And
hello?
You can go ahead on that. Is that Leanne?
It is. Hi.
Hi.
Thanks for having me today. I'm without my trusted little partner in crime, Cindy Rush. All of you may know her. She's been part of this for a really long time. So I'm going solo. So just bear with me. Hopefully I can cover it all. Anyways, Mountain Community Senior Services, right? We service the area up north of Northgate Boulevard and south of County Line. So it's basically the northwest El Paso County and Woodmore, Monument, parts of Glen Eagle. We go as far out as east on Highway 83 and west into the mountains. So that's pretty much our service area. And what we do is we provide transportation, and we are only doing social transportation right now. And even then, we're not even doing that because of the COVID, unfortunately. We do the handyman services for our seniors in our area. And the social transportation, when we have it up and running, what we do is we transport all of our clients to social events. At the senior center, we take them to the Connections Cafe that's at the Monument Church in the Mennonite Church in Palmer Lake. And we do that 4 days a week. Also, when the senior center has their events, we'll take them to the holiday parties or certain events that they have, or we do our own social, where we've taken them to Cripple Creek, we've taken them to the botanical gardens, and things just to get them out of the house and just have that social time together. So we, on the handyman side, we do all kinds of repair work, minor repair work. It could be where they need a light bulb change sometimes. They have a dishwasher that's not running, or if it goes beyond our plumbing expertise and what our volunteer handymen can do, we will hire out to local handyman service that we will work with, and they can help them out. So as far as the handyman goes, all of our people are volunteers. We're all volunteer based. So we're so excited that we do get the help that we need just through our community with our volunteers. Some of you may already know, we partnered with Envita this first of the year to help with our medical private transportation. Our volunteer base was starting to kind of dwindle, and we were getting so many clients that we were having a hard time keeping up with their needs. So we partnered with Envita. They have been coming alongside of us using our volunteer drivers to transport our clients, our riders, to their medical appointments. So our volunteer drivers still are on helping them out and getting our riders to their appointments. So we're so real fortunate to have them come aboard, because they also help with the seniors who have Medicaid, and also who need wheelchair assistance and transportation, and we were able to do that. So this is great that they've come alongside and helped us out in that area. So anyway, that's basically what we do. COVID, obviously, as everybody else I'm sure, has affected them, so we're not able to do as much as we have. We have, though, been delivering meals through the, I think it's Silver Key, or it's whoever did the lunches, the Silver, or the Cafe Connections. They make packets of meals, and we've been delivering them to our clients who aren't able to get out and do their own shopping or making their meals. So we've been delivering those, as well as our drivers have been helping with grocery runs. We've been ordering them online for them, as well as having us go into their home and help them navigate their own computer system, online, to be able to order themselves. So they don't need us all the time, but we were able to help them figure out how to navigate that so they can order their own groceries. So pretty much that's what we've been doing in our COVID pandemic situation, and it's going really well. So that's it for me.
Oh, that's great. I don't know if others of you in northern El Paso County saw this little article in our little Tribune up here where they talk about that partnership with Envita.
Oh, good.
So that was a nice little publicity for your for your efforts. So
yeah,
I saw that, great. And I thought, that's great. She's going to be speaking today.
Yeah, it's great. We've been seeing their vans all over our little town, and so I think the word is getting out that they are up here and helping us out as much as they can. I know they need more drivers as well as vans, so a little plug in for them. They need a little more help. But yeah. So
Leanne,
thank you.
yeah, Leanne, this is Wendy Farr. I just was curious, as I know we've all been saying for months, like, well, when we get back to our new normal, well, the new normal, yeah.
Yeah, I know.
So I'm just kind of curious, as looking down the road, maybe 6 months down the road, are there other things that you guys have thought about that maybe we need to consider as a council for how we can support? And I mean, because we're looking at long term now. I actually read an incredibly good article this morning on LinkedIn about how we're all good at crisis management for a short period of time, but we're moved past that. And we have to cope in different ways. And so I'm just kind of curious, because that's been in my head this morning. Is there anything that we can do looking down the road for you guys?
Well, thanks. Yeah, we actually have our first board meeting in quite some time coming up in the next week. And that is our discussion of how can we help in our community the way that it stands now. What are some things we can do? So we're getting the social director and handyman director, all of us together just to see what they have seen the needs are going beyond from what we provide right now. So I don't know what it looks like yet to how you guys, help funding and all that. I know grocery shopping and delivering of food and everything is always going to be a constant for them now. I believe they're not going to want to get out and, expose themselves into the community. And, of course, we want to try to be respectful and not, social distance ourselves with them as well. So we're still figuring it out, Wendy. Like I said, we'll have our meeting next week, and I think we can have better answers then.
Are you doing that meeting in person, or is it going to be by Zoom? Or because that's another thing that all organizations are having to come up with, like, what do we do with our board meeting? So I just curious.
Yeah, it's a Zoom meeting. Yeah. Yeah.
Welcome to the new world, right?
I know. And it's challenging to some. They're not very technically challenged. So we'll see how it works.
Okay.
It'll be our first one.
Dave Betzler here. One question, or maybe a suggestion, I guess, rather than question.
Sure.
In dealing with or getting the information out, the unmet need in this very rapidly growing area, we have the 2 new senior centers that are up here, or senior facilities. But I'm wondering whether or not the new town manager of Monument and the mayor in Palmer Lake, if they're aware of MCSS, what you're doing, and that you always are in a need for volunteers. So it's something to consider, maybe after the board meeting, thinking about how to get the information out and present yourself as an organization to both Monument and Palmer Lake.
Right, and we do have several ads and ads and papers and in our local businesses. The Tri-Lakes Cares, who's local here, who helps our community, they have all of our information, and so they are helping get the word out as well when people come into their facility there. But yeah, the town is very aware of what we do. So it's up to them if they're sharing it or not. I don't know.
Okay, thank you.
Okay, thanks.
Are there any other questions or comments for Leanne? Well, thank you so much. I live up here in Glen Eagle, so always happy to know more about the services that are available. It's always so interesting to, you talk to friends and, as they're moving into that age group, where they might need your services, or their parents are, or, or a family member are moving into that. And it's like they have never noticed until now, you know,
Right.
that your service might be available. So
Right.
it's always good to get an update on all the good work you're doing, and you and your volunteers.
Oh, well, thank you. All right. Thank you, guys. Have a great day.
Thank you. And Melissa, am I correct that our other presenter is not going to present today?
That's right. Yep. He had an emergency come up, and so I'll put him on for next month's schedule.
Okay.
And
Thank you.
then I am curious, I see that Jan called in, so I see her as a call. Jessica B and I were just talking about this, but there are 2 other folks that are on phone calls that names are not showing up. And I just want to make sure I capture if there are any RAC members that are here on the phone that I didn't see. So the people who are on the phone, one of them might be Pamela, but I'm not sure. So there's a phone number, 352. Say that again.
Calling user 1 is Elaine.
Oh, great. Yay.
The second one is Jason DeBueno with Silver Key.
Thanks, Jason. All right. So we got another RAC member on there. Hi, Elaine, and hi, Jason.
Hi, Elaine.
Thanks, you
Yes.
guys.
Hi, everybody.
Welcome.
Thank you.
Okay. So then we have membership. Wendy, do we have what's going on there?
We do. Is this just update or is this the action item?
I see. This is just the update. Should we wait?
Well, update is we're always looking for folks. So if anyone has any suggestions, as a reminder, we do have to consider the 50% in our bylaws, where 50% or more on the council need to be over 60 because that's who we serve. I'm not exactly sure where we're at with those numbers right now. That's something Melissa and I can figure out. But we're always looking for people who are interested, particularly those who are willing to participate and listen in. And, you know, lately that's something that's a little bit more of an option because of this Zoom format. We actually are able to get more people involved. So if you have any suggestions, that's great, especially because at the end of this year, there's going to be a few changes. I am rolling off. I believe Dave is rolling off, and I think Lucy is rolling off as well. So that's at least 3 people that I'm aware of. And I don't know if everyone else knows this, but I'm really grateful that Marilyn Bradish has offered to step into my shoes starting in January. And so if anyone has any suggestions, you can reach out with the contact of those individuals to me or to Marilyn, as well as to Melissa, and we'll get them the information.
Thanks, Wendy. And Jan, I guess did you have anything, or are we okay for today?
Do not have an update. Thank you, B.
No, I'm basically learning, but I actually do have a question if I could pose it.
Oh, this is Jan Zeiss, the person who is has actually submitted an application. So what's your question, Jan?
How do seniors find out about all these services?
Jody, to you.
Well, good morning, Jan. My name is Jody Barker. I'm the director of the Area Agency on Aging. And that is something that we continually work on, getting this information out to seniors. We work with an enormous amount of providers, direct service providers in the community and in the region, as well as community partners, in which we're very blessed to have a lot of community partners that are part of this board as well. And so there's a lot of word of mouth. We do a lot of promotion of our special events and promoting our providers through news and social media and senior centers. All pre-COVID, it was much easier to say who that information was coming through. Right now, because of so many of our regular senior community centers and facilities that are closed in their programs. There are greater challenges right now. So this group is a fantastic way to promote amongst your individual circles as well as the membership organizations that we are all part of to get the word out to seniors that services are available. We have our yellow book, which many of you are familiar with, that has the senior services throughout the 3-county region available. And we know that there are people who have no idea who we are. And so we are continually at work to get the word out through our regular connections as well as making new connections. So anytime we have new folks come on our board, we want to make sure that you have the tools to become the next greatest advocate for the Area Agency on Aging and the seniors with whom you're involved with. So,
Thank you.
my pleasure.
And Jody, it's time for your AAA report.
Well, here we go. We'll just continue.
Right.
So good morning, everyone. Again, this is Jody Barker. I'm the director of the Area Agency on Aging. As you know, we've had a few topics we've been talking about during this time and extra efforts that we've been making to make sure that the community knows that we are here and available and making strides in reaching out to them in our service delivery. So we have continued on with our Medicare 101 and Social Security 101 classes. Those are available at any time on our website. If you go to ppacg.org/aging, you can pull up our calendar and feel free to print those out and pass them out, forward them by email. We seriously do depend on you and other organizations that we collaborate with to make sure that seniors are aware of the Area Agency on Aging, that they have access to services. And so with that in mind, we've also, there's a new series, retirement series that is coming up, and we will get that out to you as those details are finalized, along with the appropriate links and information that you can invite those you know to that. That is a specific retirement series, so it touches a little bit on a variety of areas around preparing for retirement. So it's a really good one to watch for. We have also expanded our Medicare 101 and Social Security 101 class offerings through a partnership with the Pikes Peak Library District. And so they are getting the word out through their networks as well. So again, very good to have those partners in place with us. I wanted to take a minute and just thank our volunteers. That's you all as RAC members. That's those of you who have helped deliver yellow books or who have picked up materials to share through your networks and resources. And right now this week, that's also a couple of you who have been coming in to help cover our telephone system, including B, who has been in a couple of days over this last week to help cover. It took us a while to work out some systems with a new telephone system, how to be able to answer phones, how to make sure that we're continually available to our community. And frankly, we needed to give, many of you know Lucy Jacobs. She's our information and assistance coordinator. She also puts together the Yellow Book along with some volunteers who help proof and things like that each year. But it's so important that we also give our staff a break because it's been constant, nonstop, and in many times even busier than before March 17th, which was the magic date that we went remote. And so it's so good to be able to have her own vacation. And so I think our volunteers who are serving in this capacity to help us cover phones and make sure that community members who are calling in get connected with the resources that they need, as well as get connected with the staff who are helping them. So a huge thank you. As Leanne mentioned, and I've seen some chats here from Dave Summers with Invita, volunteers across the board, regardless of the services, and I see so many of our community partners here that truly depend on volunteer efforts to meet the needs in the services that we offer across the community, across all three counties. And it's just a huge compliment to the paid staff when we have volunteers who can help share that burden across the region. So I would encourage you to, if you're not volunteering and you're not sure how you might be able to volunteer, but you're interested, feel free to reach out to us. We can get you connected with services that are looking for volunteers, or just give them a call. How can I help? I have this many hours a week. What can I do for you? And so I know every provider here would love to hear from you. So this meeting typically ends in within about 30 or 40 minutes. I hope you'll all take a minute and give somebody a call. Go ahead and volunteer today. So go for it. I also just want to thank the TRS committee, and B will be giving the TRS update, but I just wanted you to know that we are just a few days away from executing our contracts for the next contract period, which because of the state extension of our contract is beginning September 1. That's Tuesday of next week. And so it will be a 10-month contract period. And for those of you who are providers, are contracted providers on the phone with us today, please be watching. Some of you know this because I've been talking with you lately, but for those of you who don't, please be watching for an email from me. It's going to be a kind of a long one, but it will also have a few attachments. It will give you guidance on how to access the CARES Act funding that we will have access to beginning in September. And so it will have guidance, some forms to use, as well as some timelines and deadlines. So please be watching for that from me. And so we will have through the end of the contract period, if you stay on with us into the 22 fiscal year, you would still have approximately three more months to access emergency funding, as long as we still have that on hand. So be watching for more information from me on that, how to access and what that can be used for. So we also have a bit of information here to share. It's new. A while back in other meetings, I had the opportunity to ask some questions around the Colorado Springs Commission on Aging. For those of you who have worked with me for many years in the community, you know that I love to collaborate. I love to figure out where we have those needs, where we have those gaps, and introduce folks to one another to make sure that that needs are getting met. So a topic had come up. I decided to look into how we could collaborate further with the Colorado Springs Commission on Aging. For those of you who are not aware, about 6 years ago, Innovations in Aging Collaborative began discussions around and planning around creating Colorado Springs as an age-friendly community and receiving that designation. After about a year's work, Mayor Suthers signed on, approved the work that had been done, and Colorado Springs did receive the designation of an age-friendly community from AARP and the World Health Organization. And it works a little differently than you might expect. Many times you do the work and then you receive the designation. In the world of the age-friendly system, you do a little bit of work, you receive the designation, and then you do a lot of work. And so they have been 5 years now working on a variety of programs and initiatives around Colorado Springs as it relates to being an age-friendly community. Well, in my discussion and asking some further questions, a conversation, I'll be frank with you, went a little bit different direction than I expected. Where I was thinking collaboration, they were thinking, would you take on the Colorado Springs Commission on Aging to be under the auspices of PPACG and the Pikes Peak Area Agency on Aging? And I'm sure some of you have been in conversations where you, well, that took a left turn. I did not expect that at all. And, you know, it was a good conversation. It was a very good conversation. For those of you who are not aware, actually, during the time of the creation of the Commission on Aging, which was one of the primary initiatives and very first initiatives that came out of becoming an age-friendly community, they did approach the executive director and the AAA director at that time. So almost 6 years ago now. As you know, a lot of staffing changes here, and those leaders at the time did not feel it was an appropriate fit or a proper fit at that time. Well, fast forward, I'm the AAA director, and as you know, many of you have had the opportunity to meet or hear from our Council of Governments Executive Director, Andrew Gunning. We are both of the same mind that this is an excellent opportunity for deeper collaboration while continuing to serve not just Colorado Springs, but the entire region as it relates to age-friendly initiatives and policies around policies and legislative issues around seniors and aging. So I want to let you know that those conversations are moving a little quicker than we'd really expected. There is conversation right now because it is a part of the city and it's part of the boards and commissions system within the city. There will have to be 3 meetings along with public comment for the dissolution of the Colorado Springs Commission on Aging under the city system. So it's rather involved on their end. We have already been presenting this lightly. I would say we presented it last month to the Pikes Peak Area Council of Governments board members during our board meeting. To let them know that this conversation had come up, and there is great enthusiasm for us to bring the Colorado Springs Commission on Aging within the PPAAA umbrella. The first question that may come to mind is, what does that look like as it relates to the RAC? And I want to clarify very early on that the RAC and the potential Commission on Aging would have very distinctly different and separate roles as it relates to governance under PPAAA. And by that I mean the RAC is specifically designed, created to serve as our community advisory committee directly related to the Older Americans Act funding. And so your primary role, as you know, is to review our operations vis-a-vis the 4-year plan from 2018, the continued reviews through the SRS committee, the TRS committee, which of course reviews the funding requests and is part of the funding formula decisions with our providers. So there's a very distinct and specific role as it relates to the RAC. The Commission on Aging was founded initially to serve as the sounding board for the City Council as it relates to policy and legislation around aging issues. And that's where I really see that organization continuing. And so the beauty, though, of it coming within the auspices of the Area Agency on Aging is it no longer would be strictly a city group. It would be something that we would eventually phase in, not just city policies and legislation, but ultimately county and across all 3 regions. So it's not going to be an overnight change by any means. There, we will create some a phased approach. But just wanted you all to know that that conversation is in process. And I think there are some excellent opportunities for collaboration between both organizations, both the RAC and the Commission on Aging, and whatever we end up calling that. I would love to see that ultimately truly be called the Pikes Peak Area Commission on Aging, and we could be the leader in all things aging. You all would be have the opportunity for collaboration and continued work, not just in RAC, but perhaps collaborative opportunities. So just wanted to let you know that's coming. It's in conversations. You know, it's like I said, it's one of those opportunities where I thought, let's get together and work on a project, and there was the request, like I said, kind of took a left turn in that conversation, and we came out talking very different than what we'd expected. But I think the opportunities are just immeasurable, because we can continue to grow. Thank you, Bill. I see that thumbs up. I think there's just enormous opportunity for our region. And so I love that level of collaboration that we might see through that. So just want to let you know that's coming down the pike. We'll see how it goes on the city side. They have to pass a resolution to dissolve it, in which case we'll be running in parallel as we continue to have some meetings to stand that up effective January 1. So I would encourage you to, if you have time, all of their minutes, because they are a city board and commission, all of their minutes and agendas have been posted to the city website. If you just go to Commission on Aging within the city websites, you can find more information and kind of see what their conversations have looked like over the last couple of years. And they've only been in existence, I think we're approaching 3 years. So very new organization. And I think it's a really good time for increased collaboration. So, Madam Chair, that is all I have at this time. So thank you very much. I'm open to questions before we get to our chair's report.
Right. Are there any questions for Jody? Because that comes as some new information to everybody. So I'm sure that people are sort of saying, I wonder what that means.
Well, I just would like to say, be careful about collaborating, because sometimes things get dropped in your lap that you weren't expecting them to.
Along that lines, is there, you know, since this is eventually going to be, it sounds like a merger or some sort of a incorporation of that city function into the PPACG and AAA, are there any dollars that accompany that that functional transfer?
Well, just to clarify, it won't be a transfer, and they will continue with the same budget they've had under the city, which is a big goose egg. At zero budget. I promise them the same budget that they have under the city, which is $0. However, go ahead, Dave.
Double the budget.
Yes, yes. But here's the beauty of this, because that was, there are some operational challenges within the city structure. They cannot do social media promotions. They cannot do grant writing. There's just a whole lot that they are not able to do, and they felt that they needed to really get into a structure where they have more flexibility. And so that really was that was really a big part of that initial conversation when they approached me about that. So I did let them know that they would start with the same budget that RAC has, which is donuts. And so, really we all start with a zero budget, but the beauty of that is that they have an entire organization behind them. So they have access to Melissa, they have access to Jessica M., our policy and legislative and communications manager. They have access to so many resources simply by standing up within PPAAA and the COG. So there's a lot of, again, there's a lot of opportunity that they have come to find in the last few years since they were stood up under the city that they just don't have access to. They do have a staff liaison, but their hands are somewhat tied as to actual hands-on work. And so that's where we see a big difference for them within our structure.
One last comment too, Jody, would be that I think we all owe you applause or pat on the back for recognizing the opportunity and looking at the synergy between the organizations. I think that's really a huge thing for the seniors. So applause.
Well, thank you. Thank you. I appreciate that. Like I said, there many of you I've worked with, I've known over the years. Collaboration is huge for me. And when I find that opportunity, I like to take advantage of it and get the right people in the same room at the same time and have these discussions. So we're not wasting people's time and figuring out how to better serve our community through that efficient use of resources. So thank you. I appreciate that, Dave.
Now
Any
the
other?
question is,
Go ahead, Bill.
Get this to the rest of the counties.
Yeah, so I mentioned that is the beauty of this, because that was actually a big part of why I approached them in the first place. Was there are some other communities who have had discussions around becoming age-friendly, and becoming age-friendly is not just a title, but it really emphasizes very specific work to be done as it relates to aging. A part of, you all are familiar with the Space Force that is tentatively coming to be housed in the Pikes Peak region. One of the areas that they review is actually a senior or retirement livability index that's put together by AARP and the World Health Organization. And so they actually use that as one of their standards for determining where the Space Force will eventually be. Now, specifically to Bill's question, that, like I said, that was a big part of my conversation, is how can we take this model that was very well done. They'll be doing their 5-year report out in November to City Council as part of the age-friendly process, which led me to ask, how can we replicate this across the region? Because the city of Colorado Springs is certainly a major part of who we are geographically and by population, but it is not the full picture, right? The full picture for our region is just that. It's 3 counties with very widespread needs, and yet when it comes down to it, we still have the same issues like we saw in our 4-year planning 2 years ago: housing, transportation, meal delivery. We see the same themes come up across the board. And it doesn't matter if you live in a highly densely populated area in Colorado Springs, the edge of El Paso County, or Park County. It doesn't matter. There are still important livability issues and concerns we all have. They just look a little different. So by having this age-friendly initiative and this Commission on Aging who can look beyond just our AAA dollars, just our Older American Act funding, and some of the things like that, it brings more opportunities for discussion, more opportunities for collaboration, and more opportunities for us to get in front of people who are those ultimate decision makers. As you know, the Pikes Peak Area Council of Governments is just that. It's a 16-member organization of 16 municipalities, and that's counties, cities, towns, and we have the ear, as it were, of those 16 organizations right there. They are the policymakers. They are those who we need to make sure hear from us continually around aging issues. So yes, we will phase in, we'll be building in a phased approach to making sure that this is a Pikes Peak area Commission on Aging.
Jody, something that you mentioned about the age-friendly designation that I don't know if some of all of our other members, our council members know. I mean, it sounds great, like, oh, well, we want to have this designation, which sounds really fancy, but there was a lot of work that went into that. And what's really interesting is that it isn't just, oh, well, we are going to designate, we are friendly to the aging population. But there were things that needed to be changed about transportation. A big part of that was also the road work that we've had done and the curbside, changes for handicapped accessibility. The fact that we have a senior center and all these other things. I mean, there were things that we had to put into place to be able to get that designation. Not just because, oh, well, we want to say we're friendly to seniors. But many years ago, I was an ambassador for the Chamber of Commerce, and so many of our conversations during that time I was an ambassador was around how do we attract more jobs? How do we attract those people to come, whether it's Space Force or at the time, we were looking at a variety of other big businesses. And the reason that's important is that they don't want to, these bigger, companies don't want to build in a location where their employees are not going to have what they need. So not only, well, Space Force as an example, if Space Force comes and they want to know that if, I'm a new employee and I'm going to move myself here, well, what if I do need to have some care for my parent? What's available and how do I make that possible? So there was a lot to go into that age-friendly designation. And it's not just about the seniors, it's about the caregivers, it's about the jobs that are available. I mean, it really is pretty exciting. And to have that acknowledgement from the city level too means, I think that the project has been great because people who have previously never really had conversations together had to have conversations so that we could get that designation, which is exciting because that means that's why this conversation with you actually, it wouldn't have happened 5 years ago. It wouldn't have continued. So it's exciting.
Yeah. The beauty of this, the commission, as I mentioned earlier, was one of the top priorities and very first initiatives that came out of the age-friendly process. There is that distinction and that separation between the Commission on Aging and ultimately the group, which is Innovations in Aging Collaborative, which is managing the age-friendly process. However, it's just another one of those collaborative efforts that guides so much of what the Commission on Aging has been doing over the last 3 years as they've been part of the recommendations. I believe there were something like 200 or 250 recommendations that came out of that initial age-friendly plan. And so, when you first hear it took them 5 years to come to completion? Well, that's because there were over 200 recommendations to figure out how to manage within just Colorado Springs. So if you can imagine the opportunities for reviewing everything from curb cuts to transportation to housing, you know, as it relates to Fountain, as it relates to Wide Field and security, as it relates to Palmer Lake and the Tri-Lakes area, as it relates to Cowhan and Rush and Fairplay. And I mean, the list just goes on. If we can put some of those conversations around that planning and those policy planning, I think that truly makes the Pikes Peak region the absolute best that it can be, because we're bringing those, we are highlighting those issues and those concerns to those decision makers and ultimately to the populations in those areas.
Well, thank you, Jody. You've given us an awful lot to think about, and I'm sure it's going to spur many more conversations. And it's an exciting move. And as I think, and you know, as you've described it, I can definitely see how it could extend out to Park and Teller and as well, using what they've learned, you know, along the way, and then using the resources that we have here. So this is exciting. We'll
Thank you.
Go ahead.
Thank you. I will keep you all posted as we move forward.
Great. Thank you.
Hi, it's Marilyn. Hi, everyone.
Hi.
Jody, I have a question for you. Just if you could possibly just briefly summarize or update on what has been happening with the CARES Act funding that was going to be received, like where is that going? Has it been utilized for services?
Sure. So, when April, late March, mid-April, we received the first round of emergency funding, which was actually called the Family First Act funding. That was designated through our federal overseers, the Administration on Community Living. They are the federal organization that manages the Older Americans Act. At the very beginning of the states beginning to enact stay-at-home orders, they immediately realized the need for distributing food to the seniors and community members who would no longer have access to the meal sites, much like our congregate cafes here in Colorado Springs, as well as some other meal sites throughout our region and of course across the state and across the nation. We have just finished allotting and using those dollars as part of the emergency declaration, the major disaster declaration, that expanded that initial use from just food delivery and food provision to allowing us flexibility in how dollars were used. So even someone who had contracted with us initially, for example, probably the biggest example I typically use is in this past contract year, we had someone who had contracted specifically with us for transportation dollars. Because of the stay-at-home orders and the closure of their operations, we were able, under the emergency declaration, to transfer within their contract the dollars from transportation into mental health counseling. And so we had a mix of fresh dollars as well as transfer of dollars so that those services and those needs could be continued to be met. We are now on the tail end of our 2-month contract holdover period where we received no funding whatsoever. And we had to use leftover dollars through the end of June. We remixed those, use those to support the providers through the 2-month holdover period. September 1 is the As long as everyone gets their work done, will be the beginning of the next contract period. And in which case, that was that large document that I mentioned to our providers that will go out, that will give them guidelines on how to access, the timelines, as well as the deadlines for accessing the CARES Act funding. We won't know what that final amount is yet, because in order to keep a relatively flat budget from last year into this year, we are putting into place some of those CARES Act dollars in order to maintain a flat budget from last year into this year. The state did draw down, and we are short this year in our state funding by nearly $200,000. So we're accessing CARES Act funding for that. Once we close out from the end of August, which will be around mid-September, we will have a better idea of how much will be left in CARES Act funding, but it will be around $1 million that our providers will have access to. The document that they'll be receiving by the end of this week will be, like I said, will be more specific to the guidelines, deadlines, timelines on how to access those funds, how to budget for the funds. The ACL, Administration on Community Living, actually created that funding contract to go through September of next year instead of the state fiscal year, which ends in June. And so those who are on contract with us will be asked first to budget through the end of the contract period. Then we will revisit July, August, and September if there are funds available that we still need to distribute through the September timeline. So a lot going on there to figure out what that's going to look like. We want to make sure that all of our providers know that they have access to those emergency funds, can budget for them, request them, and request them on a timeline that is very planned and considered, because it's a lot of work internally to make sure that those transfers and those emergency funds are placed within their accounts and have access to them. So we're working out all of that. In fact, I actually expect to have that wrapped up and get approved tonight and have that to them tomorrow so that they can start planning. That's where we are on that. Yeah. Thank you, Marilyn.
Thank you.
Certainly.
Thank you, Jody. Just a few items related to my chair report. First of all, our funding recommendation, I attended the PPACG board meeting on August 12th, and Jody and I presented the TRS recommendations, and those were approved, so that's always great. And one of the things I just wanted to comment on there, I imagine the PPACG gets so many documents before a meeting, so you always sort of wonder, do they have time or do they get to yours, But the questions that they posed, you could tell that in fact they had studied those documents very carefully, and they asked about a few items, such as the Park County funding, obviously, and a couple other things, the change in providers, for example. So I felt like it's always good when you have a group that's approving something this important, that in fact they study it carefully, and it was obvious that they had. So thank you to everybody for everybody on the TRS committee that worked on that, and then the full RAC that approved it and sent it forward. So that has all been approved, and Jody will be sending out those contracts, as he's already mentioned. The other thing I wanted to mention is on that agenda, our 2 new members. Remember, we approved both Rosemary and Chris Robertson at our meeting, and then that moves forward to the PPACG, and so that was approved. So Rosemary and Chris, welcome. Good to see you here today. And now it's all official, you know. So we're glad to have you with us. The other thing I mentioned, tail doves with what Jody was saying about volunteers. You know, I volunteered with the AAA for at least 5 years. It's probably 6 now this summer. And it was a part of, you know, it was like my job. You know, I went in 2 half days a week and so forth. And when that stopped in March, that was just, I felt like the rug had been pulled out from underneath me, you know. So this past week, when I was able to go in for 2 half days and answer the phone and, you know, talk to seniors and give them information, do a little research for them if they asked an unusual question, or was able to forward it to our, you know, senior health insurance or caregiver people and so staff and so forth. I tell you, I was just thrilled. I was thrilled to be back to work. And so I'm just going to say it directly, Jody. I hope you find a way to have us help out this fall with the open enrollment, because it really is, it's part of what makes being, when you're retired, it's part of what makes it meaningful, is that you're contributing to your community. So anyway, I thought I'd make the appeal in front of everyone. So
well, we'll put you at the top of the list when we figure it out.
Okay. You know, I thought I'd use peer pressure, you know. Okay, well, that's what I have for my report. I think the other thing I would like to do, Jody, is sit down with you related to this Commission on Aging and just, you know, understand better so that I can communicate it, you know, can talk to the members about it later on. So talking about that Commission on Aging and how that's going to transfer and what that means and so forth for the RAC. And so look forward to that conversation in the future.
Absolutely. Well, I will clarify, keep in mind, it is not a transfer. It will be a dissolution, and we will be able to stand it up fresh within PPAAA. So we have, we'll borrow some language, but we'll be writing bylaws. We'll be writing operation plans. We will get to start fresh with, you know, their original intent, and probably borrow from other commissions, but this will be a fresh opportunity for them to start within our organization.
Sounds great. Okay, Wendy, I think you have some members to vote on.
I do. I am very happy to report that our membership committee was able to do another interview. I'm really excited about Kimberly. So yeah, so Kimberly Bryant is the newest person who had applied that we've been able to interview. One of the things that I've been trying to do in discussions with our other members on our committee is, you know, always trying to find someone who is representing a different aspect of what our seniors need in our community. And we had a situation where we had hoped that we might have someone who is a nursing home administrator to be a part of things, and COVID hit. And so that was a difficult situation. However, ironically, at the same time, Kimberly started to become more involved and has actually participated the last couple of months with our Zoom meetings. And she's in a unique situation. She's the administrator at Namaste, if those of you who've been in the area for a while will probably recognize the name of that facility. They have long time been in the forefront of dementia care, as well as just the quality of interactions that they have with the family members as well. And they're in a unique situation because they are more of a secure facility, whereas a lot of our other nursing facilities, you know, with rehab, and they have more of the coming and going, and like maybe some of the knee surgeries and things like that. And so a lot of our other facilities are really struggling, and they're at a high point of some of the issues that they're dealing with. Namaste has sort of been kind of protected from that a little bit because there's not a lot of that coming and going. When someone's there, you know, that's the safe environment for them. And so I am so pleased that Kimberly feels that she has the time to actually dedicate to being on the board. Otherwise, I don't know that we would have someone who'd be able to, because of all the situations that are going on. So one of the things I just wanted to share about her, she's actually been an administrator since 2013. No, 2014, excuse me. But she's been in healthcare since the early 1990s. She was a business office manager before she became an administrator, which means she likes numbers. So TRS, maybe we have another person who'll be interested. But she is very passionate about the care that is received and given to the seniors that are in permanent placement within facilities. And that's something that we haven't had represented on our council. I don't know if ever that I can recall that we've had that sort of representation. And I think that's a really important, especially in this time right now. I know that she could tell you all kinds of situations about the isolation that our seniors are dealing with in the facilities. So I would like to propose her name as a vote, but before I do that, Marilyn, did you have anything you wanted to add in regards to our interview with her?
Just that I think that she is going to add such a diversity to our committee. And to add to what Wendy was saying, she is a PhD in gerontology as well. So I think this lends an expertise in this age group and diversity. I mean, she's worked with Special Olympics. I just think she's going to add a lot of dimension to our committee. And, you know, I was very much impressed by her.
Yes, so thank you. So with that, and Lucy, I messed up somehow the invitation, so she wasn't able to participate with the interview. However, Lucy already knew her and had already given her hearty thumbs up to that. So all three of us on our committee are very much positively wanting to propose her. So officially, as membership chairman, I would like to propose Kimberly Bryant as our newest council member, which will take effect well, now, and then it would have the secondary vote for the Council of Governments. So next month she'd be officially a new member. I'm not sure what we do next.
Well, we have a motion on the floor to
Here's my motion. Somebody second it.
Yes, we need a second to the motion.
I second it.
And that's
Marilyn.
from?
Marilyn Massey.
Marilyn Massey. Thank you, Marilyn. All in favor, say aye.
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 Thank you. Opposed? Hearing none. Kimberly is approved as a new member. And like you say, that will be forwarded to the PPACG
Yes.
board.
Thank you. One thing I do want to, it is sometimes hard as we're adding new people from month to month, just as a reminder that we get all of our new folks on the combined email goes out to for the link as well as the meeting materials, because not all of our new people were able to get this today. And so behind the scenes, I've been sending links out to different people. So I'm grateful for the service and the willingness for people to volunteer, which is great. Hopefully we can get everybody added on for our next meeting next month. So thank you.
Sounds great. You know, I wanted to make our welcome to our new members a little more personal here. Rosemary, do you want to say hi and just remind us a little bit about your background?
Hi. I actually come from a nonprofit background. I've been working nonprofit for 20 plus years. Prior to working at the Alzheimer's Association, I was with hospice, and then prior to that, I was in child welfare. So have a kind of large background in nonprofits and working with volunteers and the community. So thank you for having me. I appreciate it. I appreciate the invite. I appreciate Wendy. Thank you for the invitation, and I'm grateful to be here.
Well, wonderful. We're so happy you're here. And Chris Robertson, are you here?
Yeah.
There you are. Well, welcome. We're glad to have you as a new member as well. Do you want to remind our members give us a little background?
Sure. I'm currently with the Independence Center, and some of the programs I oversee are older individuals with blindness, the deaf and hard of hearing individuals, and there are several that are older in that arena as well, and assistive technology, which is where we are able to help people with appliances or upgrades to their home to make them more independent and able to live at home if that's what they choose to do. And then I have the interpretive services, where we provide interpretation for deaf people and hard of hearing people. And then prior to that, I was a director of the Colorado Health Network for 5+ years. And I've been in nonprofits for 25 years. Just say I love this work, and what I get out of doing things like this and working as well is just the pleasure that I find when I work with individuals, and we have an immediate effect on the public, and that is really important to me. And so I did work for corporations and banks before, and I was making money for the man, as they say, and I really wasn't able to see how what I was doing was affecting the community around me, and it's very important to me. So I'm glad to be here. I'm very happy. Thank you so much.
Well, great. Well, we're excited to have both of you as new members, and feel free, at the meetings, if we start using a whole bunch of acronyms and talk about things that I simply remember when I first joined. I came out of special ed, which of course has its own set of acronyms, but the aging community has their own set of acronyms. So, feel free to ask us what in the world we're talking about. We welcome you, and we welcome your experience and your expertise as we move forward. Okay, we're going to move on to discussion items. Does any member have any discussion item you want to bring to our attention?
I've got a military background, B, and I was told never to volunteer, but I took your your plea for volunteering to heart. So Jody, if there's an opportunity with the changeover, this dissolution and the reestablishment of that Commission on Aging, the Age-Friendly Commission, if there's a role that you think I could participate in or support, please use my name.
Looks like peer pressure works.
Any other discussion?
I don't have a necessary discussion, but I do have an announcement for an upcoming event. So I'm not sure where that might want to go, but now's a good time. Okay.
Now's the next, that's the next item.
So coming up on September 12th, it's Saturday. I'm I've been on the committee for the Senior Law Day for about 10 or 11 years now. And then I opened my mouth and had a conversation, Jody. I know exactly what happens when you do things like that. And now I've become the chair of that committee. So, and he's laughing at me. But we are super excited about this. So it's September 12th, 9 to 12 p.m., 9 a.m. to 12. It is still going to be from the Colorado Springs Senior Center. So that will be where we will have our speakers. However, obviously, because of everything with the pandemic, it's not appropriate to be gathering seniors there. We are going to try doing it by Zoom. And so it'll be completely virtual. We are very excited about this. One of the things I think that has really changed in all of this pandemic is that those of us who were unfamiliar with this technology have had to be forced to get more familiar with some technology. And I think some of our community members who would normally not have been okay with trying to do something virtually, I think we have people who are going to be okay with it now. So we are moving forward with a virtual format on that day. I have all the information. I will send it to Melissa so that she can send it to everyone else. What's nice about it is because it's a Zoom link, just like how we all use today. We all got that email. We clicked on that link where we were able to participate. I'm excited that we might actually be able to get even more people involved, because even if I may not be comfortable with the technology, my neighbor might be. And as long as we encourage them to keep it in small groups, maybe we could get 2 or 3 seniors gathered together to be able to hear from our local attorneys about legal issues that do affect our seniors. So as well as a couple of our assisted living buildings are actually planning on doing a viewing party. So they're willing to do it and have, a few people in their facility who can come and watch it. So it's very exciting. We're looking forward to it. It does require registration, because that way you wouldn't be able to get the link. And so I will get that information to Melissa so she can send it out. Wonderful opportunity. So if you have any questions, you can ask me, or, but again, I'll just send it out so everyone will have that. And I get to be on the news on September 8th. Yay.
Thank you, Wendy. I know I've attended in the past. I've, managed worked at our AAA booth at one of those events and so forth. There's always great information from the legal perspective, so it'll be great. Okay, any other events coming up that you want to let us know about? Okay, well, I think that's all I have. Anyone? Jody, was there something else?
Yeah, Madam Chair, there was a question around Yellow Books. I have just put the Yellow Book link for those of you who have internet access and want to share that link out. That is available in the chat. It's really simple to access though, ppacg.org/aging, and you'll see the front cover of the Yellow Book on that web page. Looks just like this. And we ask that you forward that on, anyone who might need that. As you know, though, we did receive our shipment of Yellow Books during this pandemic, and so we are making large deliveries to organizations, churches, businesses, anyone who might want those. You can call our main number there and talk with our information and assistance folks at 471-2096, or pop Melissa or myself an email, and we will coordinate larger deliveries. And then as we get individual deliveries from folks just in the community, we have an assortment of you all as volunteers who are helping to distribute those. So we thank you very much for that. Bill, Lisa and I had an appointment a couple weeks ago up in Park County. We brought Joyce a case of Yellow Books as well as a case of the Veteran Guide. So if you know of anyone who needs them out in your area, you can point them to Park County Senior Services or Senior Coalition. So
I'll pick some up from her, bring down here in the southern part.
There we go. We're happy to get those out, and whoever needs them, just ask. Needless to say, with senior centers and libraries and others closed, we have a lot of yellow books. we need to get those out in the community, so don't hesitate to ask. Thank you very much.
Great. Well, thank you so much for all attending today and contributing to our discussions. And we look forward to see you next month on the fourth Thursday. Thank you so much.
Thank you, Bees. Thank you, everyone.
Bye now.
Next month.
Thank you.
Have a good day. Bye-bye.
Have a good day.
Also.
We are adjourned.
Bye all.
Bye all.